the big things that the public healthcare system gets wrong about cancer treatment is to assume that standard pathology and testing for, inherited mutations and a couple of markers is thorough genetic testing. It's one of my big pet peeves because patients will go to their doctors and say, hey, I've heard about tumor DNA sequencing. Should I get it? And the doctors say, no, you don't need that. Or no, we've already done that for you. You know that the FDA has mandated that every cancer patient get thorough tumor DNA sequencing. That's like 300 plus genes. We use a 550 gene panel. Standard of care in Canada, for example, it really maybe tests for 10 genes if you're lucky. And I mean, if you're lucky, it's not standard across the country. A lot of patients will be told, we tested you for markers, you don't have any, therefore you can't have immune therapy or you can't have targeted therapy. And really all that their pathology lab tested them for was a couple of common inherited mutations like BRCA1 and 2 or something like that. There are 20,813 genes in the human body that can be tested for, and many thousands, and I mean thousands, of targeted therapies that are either in development or already approved and accessible if you know how to connect the dots. In other words, we need to test your tumor tissue. There almost certainly will be samples available if you've had a biopsy or surgery. Pathology labs save them for decades, but that needs to be tested so that we can identify for you specifically what are the mutations that are involved in your cancer, and then we do some analysis essentially to match those mutations to all the possible targeted therapies and help identify which are approved already with coverage in your cancer agency, which might require a little more legwork and a little more arm twisting to get you access to. But that's really what needs to be happening, and that's not at all done in public health care. What really bothers me, again, is doctors intentionally or otherwise misinform their patients, and patients come away thinking they've had thorough genetic testing and they just stop even looking at other options. And frankly, they die earlier than they have to. They miss out on critical windows of opportunity to get better treatment. And so really that's why I'm here, is to make sure that doesn't happen to anyone.